M. Past visit details. Office visit, May 23, 2022 with Daniel Lee, MD at Mass Eye and Ear Otology Clinic. Notes from Care Team. Progress Notes. 1. Daniel Lee, MD at May 23, 2022 7:30 a.m. Massachusetts Eye and Ear. MEEI Otology Neurotology New Consultation Note. Patient information. Name, Michael Ryan. Date of birth, October 30, 1968. Date of service, May 23, 2022. Identification. Michael Ryan is a 53Y. Male presenting for evaluation of vestibular schwannoma and vertigo. History of present illness. May 23, 2022. Michael Ryan is a 53Y. Male presenting to the Massachusetts Eye and Ear Otology Clinic for evaluation of vestibular schwannoma and vertigo. He was seen at Me-Ed this weekend, per the excellent HPI by Dr. Mokhtaris. 53Y. Male with complex otologic history presenting faux otologic evaluation into established care. Patient has a long history of left-sided vestibular schwannoma for which he underwent surgical resection in 2012 at House Ear Institute. He tells me this course was unfortunately CB intracranial bleed and significant TBI requiring prolonged ICU inpatient care at that time. Subsequently, he shares he has had many issues related to his TB. M. Past visit details. X. He shares he has had many issues related to his TBI including chronic headaches, memory loss, and overall difficulty returning to his previous life. The following year he moved to Texas, Louisiana and established otologic care at UT Southwestern. At that time, he says repeat imaging and evaluation demonstrated a second vestibular schwannoma on the left side. Unclear if this was truly a second CPA lesion versus residual lesion. This was followed clinically for some time, but later patient states that he was recommended to undergo repeat surgical resection versus radiation for this lesion. Of note, around this time, the patient was also found to have left-sided superior semicircular canal dehiscence. He relays that in the past several years he has had several surgical dates booked for resection of his left vestibular schwannoma and for SSCD repair. However, for one reason or another these procedures have not been able to be performed. Patient flew to Boston yesterday and is scheduled to establish care with Dr. Dan Lee this upcoming Monday, 05/23. At this time he endorses severe tinnitus as decreased hearing as vertigo, disequilibrium, and hyperacusis. He thinks his last MRI was in 2020. MRI report from 2020 located in Care Everywhere refers to a solid T1, T2 hypointense enhancing lesion in the fundus of the left internal auditory canal measuring 4.5 by 7.4 by 5.2 millimeters. He is unsure of his last audiogram, but that it's been a few years. He does not have any imaging with him at this time. Patient presents to the MEEI-ED today stating that his symptoms are making it more challenging for him to function and wanted to be evaluated prior to his otology appointment on Monday. Patient shares that he was supposed to undergo TBI treatment at an inpatient facility approximately 2 months ago. He shares that, "I'm here to see Dr. Lee to get brain surgery." His disequilibrium has been ongoing for 4 months. He notes he also has narcolepsy, seizures, forgetfulness and extreme fatigue, which he attributes to his TBI. He also has developed psychiatric diagnoses, depression, during this time. He reports that all of these symptoms began after his otologic surgery in 2012. What is your chief complaint? Vertigo. M. Past visit details. X. Hearing loss. Yes, left. Hear a ringing sounds, tinnitus in the right ear? No. Hear a ringing sounds, tinnitus in the left ear? Yes. If you do have tinnitus. On a scale of 0 to 10, 10 being worse, how severe is your tinnitus in the right ear? 0. On a scale of 0 to 10, 10 being worse, how severe is your tinnitus in the left ear? 10. Dizziness or vertigo? Yes. Discharge? No. Pain? Yes. Ear blocked? Yes. Otologic history. Left vestibular schwannoma resection 2012. Ear infections as child? No. Noise exposure? Yes. Hunting. Head trauma? No, aside from complications related to surgery in 2012. SCD questions. May 23, 2022. What is your chief complaint for the left ear? Vertigo, tinnitus. Onset of symptoms sudden? No. Duration of symptoms prior to SCD diagnosis? 2012. What diagnoses were you given prior to your SCD? Diagnosis? None. Prior ear surgeries, infections? Yes, 2012. Ear blockage or ear fullness? Yes, left. Hearing loss? Yes, left. M. Past visit details. X. Left ear. Do you have pulsatile tinnitus? Do you hear your heartbeat? No. Right ear. Do you have pulsatile tinnitus? Do you hear your heartbeat? No. Left ear. Hear your own voice echo? Yes. Right ear. Hear your own voice echo? No. Left ear. Hear your footsteps? Yes. Right ear. Hear your footsteps? No. Left ear. Hear your own eyeballs moving? Yes. Right ear. Hear your own eyeballs moving? No. Left ear. Brushing your hair or shaving sound too loud? Yes. Right ear. Brushing your hair or shaving sound too loud? No. Left ear. Sounds seem too loud or painful? Yes. Right ear. Sounds seem too loud or painful? No. Left ear. Loud sounds cause dizziness or vertigo? Yes. Right ear. Loud sounds cause dizziness or vertigo? No. Heavy lifting or straining, e.g. bathroom, cause dizziness, vertigo? Yes. Exercise or physical activity cause dizziness, vertigo? Yes. Blowing your nose, sneezing, coughing cause dizziness, vertigo? Yes. Have a sense of imbalance? Yes. Suffer from migraines? Yes. 4. History of seizures? Yes. History of head trauma? No. Did have post-operative complications in 2012. Do you have brain fog, confusion, forgetfulness, or lack of focus? Yes. M. Past visit details. No family history on file. Is there a family history of hearing loss, dizziness, or ear surgery? No. Past medical history. Diagnosis. Schwannoma. Date. No known allergies. Past surgical history. Procedure. Acoustic neuroma removal. Laterality date. Right. Shish. Occupation. Unemployed, disabled. Smoking. Less than 1 pack per day for approximately 10 years. Alcohol. Rarely. ROS. ROS. 12 systems non-contributory except for that above. No fevers, chills, ear pain, cough, heartburn, stiffness. Rash, numbness, bruising, tension, sweating, hay fever. Physical examination. Constitutional, well-developed, well-nourished, normal communicative ability, normal vocal quality, no acute distress. Head and facial. NCAT, no suspicious lesions, normal. Facial muscle tone and symmetry in normal movement, no sinus tenderness on palpation. Salivary glands normal size without masses. Right ear, auricle without deformity, lesions. Mastoid. Non-tender. Otoscopy EAC, patent. Tympanic membrane, WNL. 5. M. Past visit details. $10.54. M. Past visit details. X. Weber, midline. Rene AD, air conduction greater than bone conduction. Rene as, air conduction greater than bone conduction. No spontaneous nystagmus. Eyes, extraocular movements intact and normal, sclera and conjunctiva clear, no proptosis. Nose, no external masses or lesions. Oral cavity, normal tongue mobility, symmetrical palatal elevation with normal gag reflex, no dental pathology, oropharynx, no lesions or masses, tongue base and tonsils normal. Neck, no masses, adenopathy, or thyroid abnormalities. Audiogram. May 23, 2022. I personally reviewed the audiologic testing today and shared my interpretation with the patient. Imaging. MRI Brain 9 2020 report. M. Past visit details. X. Imaging. MRI Brain 9 2020 report. 1. There is a solid T1, T2 hypointense enhancing lesion in the fundus of the left internal auditory canal measuring 4.5 by 7.4 by 5.2 millimeters, AP transverse craniocaudal, Series Image 72, Series 15 Image 16, Series 16 Image 12. This is most likely consistent with recurrence residual vestibular schwannoma. 2. Suggestion is made of superior semicircular canal dehiscence. Correlate this finding with CT temporal bone. 3. Postoperative changes of left temporal craniotomy. Past surgery. Left middle fossa craniotomy for resection of vestibular schwannoma 2012. Problems addressed. as vestibular schwannoma vertigo. Risks of complications, patient management. 53Y. O. Male with a complex otologic, neurotologic hyster-SP is vestibular schwannoma resection in 2012 at House Institute by Dr. Friedman via MFC. He had a complicated hospital course including intracranial bleeding and TBI requiring prolonged ICU stay. He also had an iatrogenic SCD from the surgery. Most recent MR report from September 2020 demonstrates recurrent, residual vestibular schwannoma per report. Audiogram performed today which demonstrates asymmetric left SNHL. However, concern for validity of the testing today related to behavior noted during examination, i.e. right ear masked, able to easily hear, respond appropriately in conversation, inconsistencies in word recognition testing, etc. Retesting for validity of these results is recommended. (1056) M. 40. Past visit details. X. Testing for validity of these results is recommended including ABR, which can be done in Boston or in Louisiana. Patient will also require repeat MRI imaging to reassess the previously noted recurrent, residual as vestibular schwannoma, which can also be performed upon return to Louisiana or in Boston if patient would like to follow up here. Discuss that with a history of vestibular schwannoma resection, the vestibular nerve is no longer intact and therefore the afferent input from the ear is no longer functional. Discuss therefore that his ear, and even reported iatrogenic SCD, is unlikely to be cause of his vertiginous symptoms. We do not have access to the patient's prior operative report. Also discuss that CVEMP testing can be pursued to definitively assess for function of the inferior vestibular nerve. Discuss that patient had a recent CT temporal bone when he was seen at UCLA. He will work to have a disc see his imaging sent for review by me Neuroradiology. We offered for MRI and CT temporal bone in VEMP testing to be performed in Boston while patient is in tour, which he is agreeable to. I, Hannah Daly, attest that this documentation has been prepared under the direction and in the presence of Daniel J. Lee, MD, electronically signed, Hannah Daly, scribe. May 23, 2022 at 10:13 a.m. Searston Burks, MD. PGY4, Otolaryngology, Head and Neck Surgery. MGBP 23169, MEP 1402. 8. I was present while this encounter was recorded and agree that the information entered by my scribe is complete and accurate. (1056) M. Complete and accurate. I saw and evaluated this patient. I agree with the finding in the plan of care as documented in the resident's note. Daniel J. Lee, MD, Facts. Director of Pediatric Otology and Neurotology. Associate Professor. Department of Otology and Laryngology, Harvard Medical School. Massachusetts Eye and Ear Infirmary, 243 Charles Street, Boston, Massachusetts, 02114. Office, 617-573-3130. Facsimile, 617-573-3914. Email, Daniel_Lee@meal.harvard.edu.